Hi, I'm Dr. Neil Shah. I work at UCSF, where I'm leader of the hematopoietic malignancies program. One question that I'm commonly asked has to do with the safety and efficacy of the non-kinase inhibitor, omacetaxine. As you may know, this drug was recently approved for patients who have failed 2 or more BCR-ABL kinase inhibitors. Now I mentioned it's not a kinase inhibitor, it's a protein synthesis inhibitor, it's injected. We don't really understand its mechanism of action in detail, but nonetheless there are some patients with chronic myeloid leukemia who can have deep responses, including complete cytogenetic responses. Now, this agent was initially known as homoharringtonin and was initially developed back in 1995 and showed some signs of efficacy. Again, the efficacy has never looked anywhere near in the same ballpark as what we've seen with kinase inhibitors, but it does have some activity. And prior to the availability of ponatinib, there was certainly an unmet medical need for the T315I mutation for patients who had that mutation. And so this agent does have maybe a 10 to 15% chance of affecting a deep cytogenetic response in such patients. To date, the responses do not look particularly durable, unfortunately. The vast majority of patients are no longer on the clinical trial with this agent after 3 or 4 years of follow-up. But nonetheless, it is nice having one more treatment option for patients who may have blown through all the other effective therapies that are out there. In terms of safety concerns, the agent can be associated with rather substantial myelosuppression. So it has been observed that some patients have difficulties and can require transfusions following treatment with this agent. So that's something to keep in mind. But beyond that, it appears to be reasonably well tolerated, but it must be kept in mind that our experience to date with this, despite the fact that it's been around longer than even imatinib, our clinical experience to date is really rather limited. The studies that have been done have been on generally in patients with no more than 100 patients. So we have to keep an open mind as far as what its toxicity profile may be like if it gets broader use than that.